first guests are the plastic surgeons of Lexington, Dr. Joseph Hill and Dr. Mike Lynch. Now, I teased it with hair transplants, but baldness is a big issue both for men and women.
It can be more devastating for women, in all honesty, and we see kind of a mixture 50-50 between men and women that come into us to seeking out hair rejuvenation. Now,
you use hair rejuvenation. There's more than just one way to do that.
That is correct. So there's a couple treatment modalities. The big one is hair transplant, and we have a new machine that we are offering the community. An alternative, maybe sort of an introductory level treatment, is something called platelet-rich plasma, and you inject it into the scalp, you harvest it from someone's vein, and it's been shown to improve follicle counts on the scalp.
Well, tell me a little bit about the procedures that take a day, a week, a year?
So they're both kind of different procedures. The PRP that Dr. Hill's talking about takes about 30 minutes, and that's just harvesting blood and then re-injecting the plasma back into the scalp where all the growth factors are from the plasma. An actual hair transplantation takes, majority of the day to do, but within a week you're well healed and you're already on your way.
Now, the slides up there that show some before and
yes.
after, is that a typical result that you get?
Yeah, I think it's a very typical result. I think that that's what you can expect, and it's usually that around a year you'll see a very good growth of the transplanted follicles into whatever area you're placing them.
So is it one treatment, or do you have to do that continuously?
No, that's one treatment. So in one treatment you can harvest somewhere around 2,000 follicles from a patient, and then transplant 2,000 follicles, which oftentimes becomes about 6,000 hairs, to the area you're trying to transplant to treat that area of baldness.
And it's done in your office?
It's done in the office under local anesthesia. And the main difference between what we're offering and what is traditionally done is the traditional method is where they take a strip of your scalp and they have to surgically close that with sutures and staples, and that can leave a wide gap, like a scar that doesn't have any hair, that's highly visible. You can also have things like wound breakdown or infections, and what our treatment does is it takes individual follicles, so you don't have to surgically excise scalp, and then you transplant those individual follicles into the recipient site.
Well, that sounds great, and the look from the folks that I've seen that you've done really is good. It's normal hair.
It's been very rewarding for us.
Yeah, absolutely.
Lots of people are very happy.
I can tell you, I had it done myself, and it's been one of the better things I've done. It was very easy to recover from, and it's your hair, and it's changed, for me, a huge part of where I was previously, and like I said, there was very little downtime to recover from it.
Okay. Well, we also tease with body sculpting, and that's there's several ways to do that. Tell me about that.
So there's a couple what we call non-invasive body contouring devices on the market. The main one is sculpture, and it's a laser that essentially melts fat from the outside. So it's not a surgical procedure, there's really no downtime, and you get a reduction in the amount of subcutaneous fat in certain areas of the body that bother you.
Is it a one-time treatment, or you literally sculpt to what you want?
Usually that requires several treatments, and so it just takes about 20+ minutes to do in the office, and then you come back in about a month to 6 weeks to kind of treat that area as well. I think the key thing that we offer is that if it's not an area that is very large, non-invasive body contouring works very well. If it's a more substantial area, that's when you usually have to have traditional surgery done, whether it's liposuction or a tummy tuck in the operating room, to really address that.
Well, tell me about liposuction, tummy tuck, and how that compares to.
So I think if someone comes into the office and doesn't want to spend the downtime, couple weeks, with liposuction or a tummy tuck, then and maybe are looking for maybe not as dramatic of a result, then the sculpture is a good way to go. If you're looking for the probably most ideal result, you can't beat surgery. Liposuction is a treatment modality where you can see the fat being removed during surgery, and you can really sculpt the area manually versus relying on a machine. But if someone doesn't want the downtime, it's a good alternative to do it that way.
Well, that's great information. Thanks to Plastic Surgeons of Lexington to help us look better. We'll be right back.